Hello, my name is Matt Sedo, and I'm an acupuncturist at Synergy Sports Medicine. And today I wanted to show you a little bit about cupping. This is a service that we offer here. Many of you may be familiar with cupping. It's become sort of popular in the last few years. It's actually a therapy that goes back, way back, and is part of Chinese medicine, much like acupuncture, Tuina, which is a kind of manual therapy, herbs, and Qigong. It's often used in combination with those treatments as well. The process of cupping involves a few things. Basically, cups are placed on the skin. This creates a negative vacuum or a suction, and the suction draws tissue up into the cup, and this creates changes in blood flow, lymphatic flow, and may separate layers of tissue that are stuck together. There's a few different methods of cupping that I sort of wanted to talk about, and they're used for different purposes and different therapeutic aims. The first method being something called dry cupping or stationary cupping. So this involves putting a cup on an area, keeping it there a bit longer, and this is a way to really strongly improve circulation in a local area. And from a traditional Chinese medicine perspective or TCM perspective, it's used to stimulate various acupuncture points. The second method is something called fire cupping, and this is used to stimulate the skin and to stimulate circulation in a broader area. The last method I wanted to talk about is something called sliding cupping, which is used silicone cups rather than glass cups. And sliding cupping is used to separate fascial adhesions and to improve fascial remodeling. The effects and benefits of cupping, there's quite a bit. I just want to sort of highlight a few. Most patients come for cupping to reduce pain, to reduce inflammation. It improves blood and lymphatic flow, and it can help regulate the nervous system through the stimulation of sensory nerves via the skin. Some of the conditions used for cupping are myofascial pain, so things like restricted range of motion, spasms, low back pain, neck pain, plantar fasciitis, carpal tunnel syndrome. Many patients use cupping for arthritis, fibromyalgia, fatigue, exercise recovery. It reduces edema and can have an effect on swelling. What to expect for a treatment? Cupping can look pretty dramatic. It does leave circles on your back, and they can be there for 2 to 2 weeks depending on your condition. If you have sort of poor circulation, they might hang out a bit longer. If you have lighter skin, they might stay a bit longer, but they actually look much worse than they feel. And as dramatic as the marks look, there's no pain associated with it. So this is stationary cupping. The next method is fire cupping. The last method we're doing is sliding cupping.